morning, viewers. Today we wanted to bring to light some breaking medical news that may be important to you or your loved ones. Do you or someone you know currently take antipsychotic medications? Our story is about a condition known as QT prolongation and its association with life-threatening cardiac arrhythmias, sudden cardiac death, and another arrhythmia known as torsade de pointes.
Only a healthcare provider can measure your QTC, and a normal QTC is approximately between 330 and 440 milliseconds. And it also tends to be higher in females than in males. A QTC is considered prolonged if it's greater than 440, and it could be worrisome if your QTC is longer than 500 milliseconds. A concern with having prolonged QTC is that it can lead to major health problems such as arrhythmias. Some medications, such as blood pressure medications, some antibiotics used to treat infections, and some antipsychotics used for mood disorders can prolong your QTC. Coming up, we have a physician who will go into more detail about QTC prolongation and what to look out for, including what serious complications that this can lead to. But first, we have Sarah with more detail about antipsychotics that have a role in this serious condition.
There are many common antipsychotic medications on the market that can cause this condition. See if any of these sound familiar to you. One of the worst agents is Mellaril. Others include Orap, Fanapt, Invega, Risperdal, Seroquel, Geodon, and Celexa, especially at doses greater than 40 milligrams. Now we are going to hand it over to our other anchor, Susie, who will give us some more information on this topic. She interviewed a well-known doctor who is very familiar with this medical condition.
Thanks, Sarah. I'm here with Dr. Kay, our medical expert, to do an interview about this topic. Hi, Dr. Kay. Is it okay if I call you that?
Of course it is.
All right. I just have a couple questions for you about this topic. So what are some symptoms that a person who might be experiencing QT prolongation might present with?
A patient would typically present with symptoms such as palpitations, syncope, seizures, and patients may even experience sudden cardiac death.
Okay. And for these patients, what would be some risk factors that might put them at an increased risk of having QT prolongation with these medications?
Patients that are experiencing electrolyte disturbances, more specifically hypomagnesemia or hypokalemia, bradycardia, abnormal thyroid function, or structural heart disease, and patients of the female gender are all considered to be at an increased risk for QT prolongation. But of course, this story is about patients that are taking medications that prolong the QT interval would definitely put them at an increased risk.
Okay. And when you're interviewing a patient to figure out the cause of their QT prolongation, are there common questions that you might ask them, and what's the significance of these questions?
Well, when I'm trying to determine the cause of a patient's QT prolongation, I typically ask patients the same series of questions to determine if there is an underlying condition that's present. And some of these questions would include things such as, have you had any episodes of fainting or seizures? If so, when was the first episode? Recurrent unexplained seizures might be caused by QT prolongation. And as a note, in congenital QT prolongation, patients have usually experienced at least one episode of syncope before the age of 10. Another question I would ask patients is, are they currently taking any medications? The acquired form of QT prolongation is associated with the use of certain medications. Another question I might ask patients is, have they previously had a heart attack? And are they taking any heart medications? Structural heart diseases and medications for cardiovascular disease may predispose patients to QT prolongation. Something else that would be of interest to me is if the patient has been drinking alcohol, and if so, how much. Excessive alcohol intake can predispose patients to electrolyte abnormalities, which can also lead to irregular heart rate or arrhythmia. I'd also want to know if the patient has any history of coronary artery disease. Ischemia promotes QT prolongation. I would also want to know if the patient has any family members with heart problems. Genetic abnormalities may cause congenital QT prolongation. Another question I would probably ask patients is, is there any family history of fainting, seizures, drowning, arrhythmia, sudden cardiac death, or if anyone has needed a pacemaker in their family. These types of symptoms can show a familial link with QT prolongation syndrome. And I would also want to know if there's any personal or family history of deafness. Congenital deafness is associated with a form of congenital QT prolongation.
sounds like a very in-depth questionnaire that you have for these patients. So if you do decide to start patients on an antipsychotic that could prolong their QT interval, what are some things that you would monitor before and during their treatment with the antipsychotic?
Well, prior to initiating treatment, I would need to obtain a baseline serum potassium and serum magnesium. And if these levels are low, I would need to correct those before starting any therapy. And during therapy, I would monitor their electrolytes periodically.
Okay. So if someone that is on treatment is experiencing QT prolongation, how would you treat them? Like say they're on ziprasidone and they begin experiencing the QT prolongation, what would you do for that patient?
Well, the first thing I would do is look at how long is the QT prolongation. If it exceeds 500 milliseconds, the medication should definitely be discontinued. And a different medication should be initiated with a lower risk of QT prolongation. And as a note that I just want to mention that any medication such as ziprasidone should definitely be avoided in patients that have a history of QT prolongation, heart failure, or cardiac arrhythmias.
Okay. So for these patients that these antipsychotics are contraindicated, what are some alternative treatments for them?
I would suggest utilizing medications that do not increase the risk of QT prolongation. I know someone had mentioned earlier a list of several medications that do cause that, so you should definitely stay away from those. And then you should also try to utilize non-pharmacological treatments as well, such as psychotherapy or electroconvulsive therapy.
Okay. Well, thank you so much for your time, Dr. K. We really appreciate it. And now back to you, Sarah.
Thank you, Susie and Dr. K, for that valuable information. Now we have our street correspondent with a first-hand account.
Stacy Black, can you tell me what happened to you?
I woke up to get a cold pop, and next thing I know, I couldn't see. I felt real dizzy, and my chest hurt, and I thought myself, Lord Jesus, it was my heart. So I ran to the phone, and I called 911. I didn't grab no shoes or nothing. They said the pills got me. I got palpitations. Ain't nobody got time for that.
Thanks, Spicy Black, for that first-hand account. We have presented you with a lot of information today. Some key points to remember. The most common medications to cause this condition are antipsychotics. You should contact your doctor immediately if you experience any difficulty breathing, sweating, or feel like your heart is racing. Although the condition that we discussed today is serious, it is also rare, and you should always consult your doctor before stopping or starting any medication.
Remember, your doctor has decided that the benefits of these medications outweigh the risks, so you should always talk to your doctor. For more information, please visit www.rxforyou.com. For more information about QT prolongation, including references of MD Consult, Lexicomp, and recent studies that demonstrate the adverse effects of these antipsychotics. Thank you all for tuning in to RX4U for the morning news. Stay classy, SIUE.